Definition: chronic venous disease or chronic venous insufficiency. Chronic venous disease, any morphology and function abnormality of long duration affecting the venous systems, manifest symptoms and or sickness indicating a need for investigation in the treatment. What is this definition? Chronic venous insufficiency. Chronic venous insufficiency is a term reserved for advanced chronic venous disease.
We are not, your slides are not moving. We are still in the first slide.
Is it okay?
Not yet. Oh, yes, we are in the definition slide now. Proceed.
I'm sorry. My presentation in a topical heparin preparation in the treatment of varicose vein. Definition: chronic venous disease or chronic venous insufficiency. Chronic venous disease, any morphologic and function abnormality of long duration affecting the venous system, manifestation of symptoms and or signals indicating a need for investigation and treatment. But chronic venous insufficiency is a term reserved for advanced chronic venous disease due to venous function abnormalities, production, edema, skin change, or venous ulceration. Epidemiology of chronic venous disease affect the venous system of the lower limbs of 8 or of 10 patient visit GPS doctor. A risk factor association with chronic venous progression with family history or chronic venous disease, female gender, previous episode of DVT or CVT, lifestyle including standing occupation and poor physical activity, obesity, multiparity, oral contraceptives, and constipation of low fiber intake. Signs and symptoms of chronic venous disease. Symptoms of chronic venous disease are pain or aging, feeling of swelling, muscle rhythms, itching, cramps, burning sensation, restless legs, feeling of venous claudication, secondary symptoms, and cosmetic dysphagia. Signals of chronic venous disease with telangiectasis, reticular and varicose vein, edema, skin changes with pigmentation, lipodermatosclerosis, atrophy blanche, corona phlebistatica, eczema, or ulceration. The role of venous hypertension and inflammation in chronic venous disease and progression. Risk factor of chronic venous disease, increased hypertension and valvular discording with venous hypertension. This ischemic implication of pathophysiology process of chronic venous disease. The presentation development of venous hypertension lead to pain, skin changes, edema, and ulceration with inflammatory change. Steps of inflammation process. Leukocytes at the heart of the chronic venous insufficiency include pro-inflammatory factors, include the expression of adhesion molecules and endothelium as well on the circulation leukocytes. Adhesive molecule and leukocytes in the surge. The endothelium became thickly leukocytes rolling, the adhesion to surface of a blood vessel. The leukocytes release inflammatory mediators and migration into the tissue, including the granulation to proteolytic enzymes such as metalloproteinase, toxin, prim, and radicals. The basic of CEAP classification, including the clinical classification, etiology classification, anatomic classification, and pathophysiology classification, with CEAP classification of chronic venous disease. What is in CEAP classification C1? C1 with telangiectasia, reticular or spider vein. What is telangiectasia? Telangiectasia are small delete veins in the skin, and reticular veins or spider veins are just under the skin. In the C2 CEAP classification with varicose vein. Varicose veins are delayed with elongated and usually tortuous vein. They have a large diameter, the telangiectasia, and reticular veins. C3 CEAP classification with oedem or lymphedem. Oedem is perceptible increase in volume of fluid in the skin and tissue under the skin. Venous edema is caused by an abnormality of the lymphatic system, unable to remove fluid and molecular proteins from the tissue. It occurs most frequently in the ankles. C4, skin changes, pigmentation or eczema. With purpuric dermatitis, pigmentation corresponding to a growing darkening of the skin due to accumulation of blood, usually occurring in the ankle region. Pressure inside the vein leads to varicose eczema, as well as more severe skin damage. Skin change of lipodermatosclerosis is localized inflammatory with fibrosis. CEAP classification with atrophy blanche. Atrophy blanche is a zone of whitish and atrophy skin, surrounded by dilation capillaries and sometimes hypertension. It is linked to the total disappearance of capillaries. CEAP classification 5. Healed ulcers. Venous ulcers are open sores that affect the entire thickness of the skin. They frequently fail to heal spontaneously. They occur most frequently at the level of the ankle. Activate ulcers. Venous ulcers are open sores that affect the entire thickness of the skin. They frequently fail to help spontaneously. They occur most frequently at the least of the ankle. Diagnosis chronic venous disease include level 1, level 2, or level 3. Investigation of patients in a different CEAP clinical case. Level 1, this history and clinical examination, which could include a health Doppler or color flux Doppler ultrasonography. Level 2, non-invasive vascular laboratory with detailed duplex ultrasonography scheme, which can include transabdominal ultrasound, 15-bit or with plethysmography. Level 3, invasive investigation or complex imaging staging, including accessing or transfemoral, which include phlebography, varicography, CT venography, MR venography, or EUS. What is treatment with chronic venous disease? Lifestyle, sport, and physical therapy in chronic venous disease patients. Compressive therapy, treatment to apply pressure to the lower extremities, is the fundamental complete for managing chronic venous disease. The following devices are available: compression bandage, compression stocking, Velcro device, compression pumps, and Hydris device. Sclerotherapy, used to treat spider vein, involving the sequential injection of medical solution into varicose point along the spider vein with improved solutions. This occasions an irritation of the inside of the spider vein, leading team to shrivel up and fire away over time. Surgery, stripping. The stripping is attention to the upper part of the vein. As it is pulled on the bottom, it brings with the vein. Phlebotomy, a small hook is passed through the including and the portion of vein extraction and excite. And endovascular protection, a probe is interesting into vein and gradual drybacks, and the energy is developed. What is the local therapy in the chronic venous disease? Heparin preparation, herbal preparation, and prostaglandin analog 8-1 PGA1. What is topical therapy? What is the therapy in a CEAP classification 1 and C6 stage? Only local activity with no effect on deep veins and systemic circulation. Two types, well-being creams and medical position. Heparin is only affect the area of application. Local heparin preparation should not be used for ulcers, bleeding, and superficial vein infections. What is exclude the use of local heparin therapy? The patient has a venous ulcer, edema and swelling that do not go away, changing in the skin pigmentation, inflammation, and fibrosis, severe pain in the legs, burning sensation on the skin. The skin is warm to the touch, darkening skin color, walking in the difficult, the problem warms after walking, and without treatment suggested during the use of local heparin presentation. Impact heparin, antithrombotic, anti-inflammatory, and anti-edematosis. Anticoagulant effect. Heparin show an effect with our basic groups of enzyme proteins involved in the process of blood coagulation, but enzymes respond for the formation of thromboplastin and thrombin, prevent prothrombin to thrombin, fibrinogen to fibrin, and blocks plate aggregation. Anti-inflammatory activities, cells involvement in the inflammatory response, leukocytes, lymphocytes, neutrophils, and eosinophils, and mediators on inflammation, cytokines, and complement system. Anti-edematous effect of local heparin preparation include improves microcirculation, promotes to neoangiogenesis and epithelialization. Application in period of 4 weeks, 2 times a day in the thin layer. The result, reduce pain, reduce raiding of the skin, and reduces edema. Topical therapy, only local activity with no effect on the deep vein and system circulation. Quickly and effectively removes pain, feeling of heaviness in the legs. Significant reduces leg edema. anti-inflammatory action, and unique formulation. Thank you so much. Thank you for your attachment.
Thank you so much for the good presentation.